We are talking about sudden death that ensues after an emergency states, and the time period is usually 24 hours. That is regarded as the WHO criteria for an unexplained or an unexpected death. So we have dealt in with the other systems, and that can lead to basically the foundation of the sudden death. And over here, we are describing that it can be any other fulminating disease or any other chronic disease that can couple up with a traumatic condition, and that can lead to be the foundation of sudden death. So over here in this section, we'll be dealing with the trauma and disease hand in hand. Sometimes there is a condition, a diseased state, that proves to be fatal in a particular kind of an environmental condition that proves to be fatal for a particular person. So it depends upon case to case, whatever case we're investigating and whatever case we're performing our autopsy on, we have to look for the underlying causes of death in that particular case. In this section, we are going to deal with the coronary atherosclerosis that can couple up with any traumatic condition and lead to be the cause of death in a lot of cases. Subarachnoid hemorrhages are defined as basically the hemorrhages that take place in between the space of the pia and the dura mater, and that is usually filled up with the cerebrospinal fluid, and usually the vessels and the arteries bathe in that cerebrospinal fluid. And if the space is filled up with the blood, that can prove to be fatal after a traumatic condition. Pulmonary embolism that usually couples up with the traumatic state, and it can lead to a pneumothorax-like a condition, and that proves to be an emergency in a lot of cases. The relationship between trauma and disease is quite interesting. It is usually an acute medical legal problem because whenever you couple up a trauma, and now trauma can have its medical legal aspects, it can be of a societal, homicidal, and an accidental nature. So we have to couple up these with the investigation that has been carried out on the basis of the history, the past history that gives you the clues that the person was suffering from a particular chronic disease. So we'll have to mold our investigation according to that. The ruptured various aneurysms is basically a birth defect that is usually undiagnosed in a lot of cases. So the head injury is going to basically mold upon that various aneurysms and is going to make that aneurysm rupture. So we'll have to find out what was the medical legal aspects of that head injury. The issues to be addressed at the autopsy are quite in general, that is the causes of death, whether it was the injury or the disease that caused the death. The death was entirely due to the injury or it was entirely due to the trauma. The death was due to the combination of both. So we have to weigh whether it was the injury or whether it was the disease that led the foundation to the death in a particular case. The coronary artery disease, pulmonary embolism, and the subarachnoid hemorrhage. These are the mainstays over here that usually occur after a traumatic condition, and that is going to couple up with the disease that was already encompassing in that individual. The coronary atherosclerosis, this diagram is basically giving you an overview that there is usually fat deposits in the arteries of the cardiac muscle, and this is going to be the condition in that particular state. Now what happens is that years before the traumatic episode, that coronary atherosclerosis is there, but that didn't cause the death in that particular individual, and he was dealing with that state. What caused the death in that individual is a direct blow on the thorax from the front. And after that direct traumatic lesion of the coronary system, there is a subintimal hemorrhage that occurs that precipitates the coronary thrombosis. Now, contraction bands are seen in that particular case in cardiac myofibrils. That is again going to be seen on autopsy, and coronary artery stenosis has to be looked for in that particular case, whether it was the coronary stenosis or whether it was the trauma that led to the death in a particular individual. As you can see over here is the atherosclerotic clot, and after the injury or after the trauma, there is a blood clot or that thrombotic lesion is hemorrhaged in that particular traumatized condition. So, myocardial infarction or arrhythmia was the cause of death in that particular individual. We have to weigh that, and transient hypertension or tachycardia is seen in that individual. It precipitates the subintimal hemorrhages after the trauma. These subintimal hemorrhages are the cause of death in a lot of cases. Cerebral or subarachnoid hemorrhages are also the cause of death, and they prove to be fatal in a lot of individuals as well. The chest pains and breathlessness is seen in a lot of cases. That basically gives you an idea that the cardiac muscle is working insufficiently in that particular case. So the primary cardiac arrest is seen in that particular case, and splitting or dislodgement of an atheromatous plaque is also seen after that traumatized state. Subarachnoid hemorrhage is seen. So as you can see, it's basically this space that is between the pia and the dura mater that is filled up with the blood. And if it is magnified, this is basically, it can be an aneurysm that is ruptured after a traumatic injury or after a head injury, and that caused this aneurysm that is already present for so many years, but it was ruptured after that traumatic condition. So trauma and natural disease, they usually interact together, and they lay the foundation of death. And Berry's aneurysm, it remains undiagnosed in a lot of cases. And sometimes the people would suggest or give you the history that the person was hale and healthy before that trauma occurred. But upon careful investigation, you're going to find out that he was suffering from Berry's aneurysm. So arterial blister bursting is one of the phenomena seen after the head injuries, and there is a transient rise in the blood pressure and the pulse rates as well. The alcoholic intoxication is seen in a lot of cases as well. So it's again a diagram that is emphasizing on the fact that any injury involving the skull, it can be a direct blow, it can be a coup or a contre-coup injury, it can lead to the condition that is known as the subarachnoid hemorrhages, and it proves to be fatal in a lot of cases. On a careful autopsy and after a brain section has been sent to the histopathologist, one can see whether it was of any toxicological analysis are done on that, whether it was a poisonous state or whether it was some hemorrhage that laid the foundation to death. Death due to subarachnoid hemorrhages are quite common, and what at autopsy, it is not quite helpful in assessing whether death occurred due to that subarachnoid hemorrhage or not. Contribution of assault or a pre-existing disease is going to be there, because this subarachnoid hemorrhage usually doesn't occur in an isolation. So unless aneurysm is large and fragile, one has to be quite careful, because sometimes the aneurysm is so small that it can be looked upon, and sometimes on autopsy you don't see any abnormality in the brain vasculature. Now, talking about the pulmonary embolism or the DVT, it is a common sequel to the injury. The local injury to the vessel walls is usually found in these cases, and there is an increase in the coagulability. Contralaterally or bilaterally, it is seen as likely to occur in an ipsilateral limb at that level. Now over here, as you can see in this vasculature, there is a damage to this lobe of the lung, and it is damaged due to the fact that there is an embolism in the vasculature. So DVT is one of the leading causes over here. It is post-dated or antedated injury. Histological dating of the embolus is again important, and inspection of the thrombomural junction is again very crucial over here. What are the causes to this DVT or this pulmonary embolism? It can be trauma, surgery, or any sedentary kind of a lifestyle or immobility. It can be the leading causes over here. So in this section, basically, we dealt with in that the fact that there can be a chronic disease that can couple up with a recent trauma, and it can lead to be the foundation of death in a lot of cases. So that is the end of this section. Thank you for watching scardia.com.